What is your position on universal health care and why?
Well, it all depends what you mean by universal health care. If you mean a system that is basically government run, if you mean socialized medicine, I'm not for it. Look, my opponent works for the Kaiser system. Kaiser system works for some people. Other people don't think it works for them. Some people like Blue Cross Blue Shield. Some people want to have only those doctors within a system. Some want to have doctors that are primarily in a system but be able to go outside that. I think what we need to do is to understand that whatever we do improves and increases the relationship between the doctor and the patient. And that whether it's government, whether it's insurance companies, whether it's HMOs, whether it's a Kaiser program, the focus shouldn't be on that. The focus should be on how do we improve the ability of you to have a relationship with the doctor that you have. And there are a number of different things we're trying to look at. One of them is, if you look at the people who are uninsured, a large segment of that are people who work for small businesses. Why? In many cases, small businesses are least able to pay for insurance for their employees. So I support an idea where you can bring associations together, where small businesses can get together in associations, and because of their larger size, can actually be able to get premiums at lower levels. I support health savings accounts, which allow you to set aside money tax-free to be able to utilize some of those funds in terms of your health care costs. There are any number of things. Those are just a couple. But those things, it seemed to me, are extremely important so long as we try and promote the relationship of doctor to patient rather than the third party making the determination. I got a lot more to say, but my time's up.
Universal health care refers to a system in which everybody, usually in a country, has access to necessary medical care. Most universal health care systems in other countries are single payer, where a government institution is basically the insurance company, the single payer. There are examples of successful universal healthcare systems such as Switzerland and Germany, in which there are still multiple insurance companies, multiple payers, but they are strictly regulated by the government. The United States is the only Western industrialized country that doesn't have some form of universal healthcare system, and yet we pay 2 to 3 times per capita more than the rest of the industrialized world on our health care. On top of that, our overall measures of health quality based on organizations such as the World Health Organization are in the lower half to the lower third compared to those other industrialized countries. There are 3 main factors leading to the problem in the United States. One is the for-profit motive. Outside of the government programs and the nonprofit HMOs, most of our health insurance industry is run for profit. The motivation in a for-profit health insurance company is to avoid insuring anybody who's sick or likely to become sick. And that's a crazy way to run a healthcare system. We next have all the tremendous redundancy with all the redundant health insurers in our country and all the administrative overhead that entails, so that we pay about twice as much of our healthcare dollar toward administration as the other countries do. And finally, going back to Medicare Part D, the government doesn't use its purchasing power to leverage down healthcare costs. I'll go back to that in my last 1 minute.
Diversity of opportunity will probably provide the best coverage overall, and that's why I would go against a single-payer system where the government has the last say. I would rather be treated here in the United States than in Great Britain or Canada, which have single-payer systems or government systems. I still think you have to recognize that, look, the fee-for-service system probably has a tendency for abuse by costing too much. The controlled system has a possibility of abuse for giving too little treatment, because that's the way you save costs when you have an overall limit to how much money you can get over a particular year. Neither one of them is a perfect system. That's why I'd like to see a number of different systems. Additionally, we need to do something in terms of IT so that I can have my records available instantaneously, protected by privacy, so that we wouldn't have a lot of these lost records that are out there and having procedures that are redundant or unnecessary.
With an individual savings account, if you go to a major health insurer and say, I've got $50,000 in my individual savings account, I want to get a better rate from you, they're going to laugh you out the door. If, as the state of California or the United States government, you go to health insurance plans and say, you know, we want a better rate, or we're going to contract with someone else, they're going to take you seriously. I support SB 840, Senator Kuehl's bill for a single-payer universal health care plan in California. I had the honor of testifying on behalf of the earlier version of that bill, and Senator Kuehl endorses me. Unfortunately, Governor Schwarzenegger vetoed that. It'll probably come back as a state initiative in 2008. Do not be scared by rationing, socialized medicine, those type of scare tactics. It would provide better care at much less cost for the people of our state.